right. Hello, everybody, and welcome back to the TBS series. Again, the TBS is Towards a Better Society. We love to talk about things, that would help us better our society as we go. Hopefully we can get a tip or two from here that would help better our lives or help take a better decision as
Mm-hmm.
we go. All right. So today we have a wonderful topic, and we'll be talking about oral health for kids. Funny enough, some of us do, will I say ignore it,
Yeah.
but so I thought, why not? Let's talk about that, and see what are some of the things we should know about the oral health of our children, so that way, when they get older, it could be a better, will I say, experience for them in their dental health as well. All right, so today I do have Ule Wanki, who is here with us. She's a dental practitioner, both for adults and kids, and she also works with people with special needs as well. What better person to discuss this with us other than Ule today?
Thank
Ule,
you.
welcome to the
Thank
show.
you. Thank you for having me, Ify. Thank you.
Thank you,
What an
thank
honor.
you, and
Thank
good
you.
to see you too.
Thank you.
Awesome. All right, so let's dive into it, right? I'm sure all of us are all guilty in one way or the other. Like I said, we kind of ignore the fact that as long as our children
Except
don't
for me.
have, okay, because she has a better knowledge, I'd say. All right, as long as the children don't have any toothache, why should we be in the dentist and all of that?
Mm-hmm.
So, from your own opinion, obviously as a dental practitioner, can you just tell us, this oral health, what it entails?
I think most of the time when we hear about oral health, it's not just about your teeth per se. It's about literally everything that you use to smile, to chew with. So that includes the teeth, the gums, the bones that hold your teeth together, and pretty much everything in the oral cavity. So it's just a general well-being of all of these things put together.
So it's like everything inside of the mouth, I would
Pretty
say.
much,
Pretty
yes. Pretty
much.
much,
So it's all put together that comes together to be
yes.
that oral health that we're talking about. So, I mean, how important is it in our children?
Oh my goodness! Oh my goodness! It's very very important. I think in my experience, one of the reasons why parents put it off, um, to me, it's more or less people. Like most of the times, parents don't want to subject their children to being in the dental chair. Most of the parents themselves are even scared of sitting in that dental chair, and we tend to instill that fear in our children too. They don't want their kids to sit there and go through all of that. And so we usually tend to wait until the child is in so much pain, and then we rush to the dentist. I mean, at that time it's already too late. Really,
That's right.
there's
That's
a
right.
lot. There's a lot more going on
That's
when your
right.
child is in pain.
Uh, so we need to be a little more observant, or we need to do the things we need to do early enough,
Yes, you should be looking in your child's mouth all
all
the
the
time.
time.
All the time you
All the
should be, and
time.
pay attention to those little. It hurts here. This hurts. You should be looking into your child's mouth all the time.
I see. So, is there really any special thing that, will I say, affects children? Because I don't know if that's a true statement, but some people would say maybe the child was born with a weak gum, so maybe that affects the dental formation. Is that even a true statement or no?
No,
No.
no.
Okay.
Okay, I mean, genetics has a role
To
to play
play.
as well. Now, some people have gum disease running in their family, but I always
Oh,
say if you happen to realize that your family has a history of gum disease, that means you even have to work way better than
extra
me or
hard.
than others who don't have that running in their family to keep your teeth really nice and clean. So it's not an excuse. Usually it is an excuse for most people, but it should be a motivation for you to keep your teeth looking nice and clean. Now, on the other hand, there are some children that are born with like dental defects from birth. That's normal. Just like people who are born with defects in their heart, there are
Uh-huh.
children that are born with either malformed dentin or malformed enamel on their teeth. So those are common, and there are things that we can do to improve the way their teeth look over time.
Oh,
Yeah, but again, keeping those teeth really nice and clean will go a long way to like improve things, for that
and
child.
yeah, that's awesome. And I'm sure she'll be telling us how to do that. So,
Yeah.
okay. So I know, growing up as children, they would always say, "Oh, you don't eat too much sweets." it's going to make your teeth, go bad and all of that. Is that also a true statement? Because all of these things we heard when we're growing up, let's confirm them today.
Okay.
So is that a true statement?
Yes and no.
Or are they trying to stop us from eating our sweets?
Yes, even if we see that people are still eating, the parents to go to Walmart and Sam's Club and buy bags and bags of
Oh my
candy and keep it
God.
at home and
You
give
have
it to
no
their kids.
idea.
So yes and no. Yes, and the fact that I think, because explaining to a child the whole process of cavity formation, it can be a little difficult for them to understand. So it's easier for us as parents to
To
just
just
say,
say,
"Oh, it will
don't
cause,
eat
yeah,
it.
don't eat it. It's gonna rot your teeth away." So that's why I said yes, but no, as in just eating your candy and drinking your pop. It's not directly or immediately just gonna destroy your teeth like that. It's a whole process. So what happens is the candy that you eat, right? There's when you eat that candy and it stays in your mouth or it gets stuck on the grooves on the chewy surface of your teeth. We typically have bacteria in our mouths. Now, there's specific bacteria that causes cavity, right? Now,
Oh.
bacteria feeds on sugar. So
Oh.
once it feeds on that sugar, the byproduct of that or the waste of that is acid. Now, when the acid sits on your teeth, that's what causes your decay. So it breaks down, that acid on your teeth breaks down the teeth surface, and that causes that hole on your teeth, which we call a cavity. So yes, having the sweets in your mouth or the sugar in your mouth goes a long way to feed
Oh.
off that bacteria in your mouth too. So it's a whole process, but that's why we recommend that if you're going to drink soda, you want to drink it at meals time, and then maybe rinse with water, or try to avoid it as much as possible. So not all the time, especially before bed. So brush, brush, brush to get rid
Brush,
of all of
brush,
that sugar.
brush. There you go. I like the way you broke it down. I think I'm beginning to appreciate appreciate how this whole thing comes together. Oh, now I see. Okay, cool. So, I mean, I could steal that explanation when I'm trying to tell my kids, stay off
Yes.
sweets, here's what would happen, and all of that. So, even if I were to say, well, obviously, people wouldn't have the time to do that, but assuming you had all of the sweets per time, so if you quickly go brush, it could help save, like a stitch in time saves nine. It could help save, issues coming up with your dentition maybe in the near future.
Because the idea is you don't want to be feeding that bacteria continuously. Because if you think about it, most teenagers, especially now it's summertime, and they sit, or if they go out there, or they're using sport drinks and then they're playing, they're consistently just
Consuming
sipping,
this
yeah,
products, yeah.
sipping all this soda. So you're consistently just feeding that bacteria in your mouth.
And
Yeah,
it's very happy.
yeah, yeah, yeah.
And we don't want to keep them happy. Okay, sounds good. That's a good point to note. So, I mean, back to our kids, because today we're trying to look at the children,
Yes.
especially from the stage of infancy, I'd say, when is a good time to start this oral, will I say oral health check or oral health protection, or,
That's a good question. Typically, once you put to birth and you take that child to go see their pediatrician, they will recommend or they'll let you know by their first birthday. So on paper, it's by your first birth, by that child's first birthday, you want to bring them to the dentist.
at
Now,
that.
by their first birthday. So by
Oh,
their first birthday, you want to bring them to the dentist.
so when they turn one.
One. Now we all know that if you bring a 1 year old to the dentist, I've seen a couple. I've seen a couple 1 year olds, one plus.
And they cry all their way through.
They do cry all the time, and they don't want to open and
Oh,
stuff. I
yeah.
mean, at that appointment, we're not doing too much. We just want to make sure that their teeth are where they're supposed to be at that age, and there's no visible cavities. Most of the time, they don't let us do anything, and we put fluoride on there. And your pediatrician is also looking when they put fluoride on there. Hopefully, yeah. And at this stage, the parents are usually our eyes, because again, we want to encourage you to be looking into your child's mouth. So if you ever notice something, or you have any doubts, you can always just call us and call your dental office, I should say.
So
With
when
any
you say
concerns.
notice something, what are the things we should notice or look out for?
We don't want to. I mean, if you know things that are not normal. For example, dark spots on your child's teeth, or any holes, or any
Yellow
brown
colors,
stains or
brown.
yellowish stains that will not go away after brushing, or after maybe cleaning gently with like a soft cloth or something, that will not go away. And we want to, and anything with the, not necessarily the teeth too, you want to be looking for signs of infection to any kind of swelling around the gums, or redness, bleeding, any kind of lesion, maybe around the tongue too, or the roof of the
The roof
mouth,
of the mouth, yeah.
anything, because that's stuff that we also are concerned about. So it's not just about decay. There's also gum disease.
Yeah.
That's another point of it. And then there's also oral cancer as well. I think that's the part that most people also forget. We focus so much on the decay.
On the teeth,
but
yeah.
back again, we're talking about kids, and so decay is like very, very important. It's actually the number one chronic childhood disease is tooth decay.
Tooth decay.
Yeah, for
Yes.
children.
A lot of people suffer that from
A lot.
your very young age. Yeah.
Yes, and
So-
it can affect that child's learning, the child's speech.
and it's very painful too.
It is very painful, and guess what? You can lose wages too as a parent, because you don't sleep at night. You have to take time off work to start looking for a dental office that will see your child. So it doesn't just affect that child maybe directly, but indirectly also,
Also
it
affects the parents and
as
the
well.
guardian as well. That's a great one. Okay. So start early is what you're saying.
Yes.
When, even as early as 1 year
Yes,
old.
every 6 months. Don't feel like you're wasting your time. Or and the one benefit, like most another benefit of bringing your child early, is that they get to be comfortable being in that chair. Because if they come the first time and they cry, that's okay. Your child does not know me. I don't know your child. It's normal for them to be scared. I'm a stranger to them. Plus, when they see that white coat, they always think of, are they going to pull my tooth? Are they
Yeah.
coming with a shot and
Yeah.
stuff like that? So that's very normal, and that's okay. As a parent, you voice your concerns. You talk to the clinician, and we can all work as a team to try and help your child. But the more you bring them every 6 months, which is the recommended
They
time,
get familiar with the process.
they get familiar with it, so they know that we're not the bad
So
guys.
6 months is the recommended time, you
Yes.
guys. Okay.
Every 6 months.
All right. I hope I'm taking notes too. We're all guilty somehow. Okay, cool. So I love that you said, it's good to start early, because like we said, we've seen a lot of people who suffer toothache from a very young age.
Yes,
And the pain is excruciating.
you can
it's
have serious
frustrating.
infection and end
Yes.
up in the hospital with serious. I mean, there've been cases even in the U.S. that people have died from tooth decay. Surprisingly, yeah. And I tell patients all the time, it's never okay to leave tooth decay in your mouth. It starts small, and over time it
Keeps
grows.
going,
It keeps
yes.
growing, and your decay does grow. It really does grow. And
So at
your
that point, what do you do? Because is it better to just extract the tooth, or there could just be a feeling that could save the day, I'd say?
Yes and no. So when you come in, depending on how you're feeling too matters. So you want to describe your symptoms to the clinician, and of course we're going to take X-ray to see how
The
big that
extent.
decay is. Now if it's just like a little cavity, something that they can just put a filling there, they will put a filling on there, and then hopefully things stay okay. Now if the decay is so big that a filling will not suffice, well, your clinician will be talking to you about other options, maybe a root canal. Of course, the downside to that is the cost as well of getting
yeah.
something like that done. And then obviously the last option on the table is just removing the teeth. We never want
You want
to
to
have
get to that
people
point.
remove their teeth. So it's always nice. They always say prevention is better than cure. Do it when it's like little, the cavity is so little, and then you can just fix it. I do understand we're busy with life and all, and stuff happens too, and that's okay.
Yeah.
But try and prioritize your oral health as well. It's very important. I sometimes when I joke and say your mouth is here, your brain is right here.
So it's pretty close.
It's a very short distance for that bacteria
Yeah.
to travel from here to here or from here to here. It happens. Yeah.
Interesting.
So go see your dentist.
Go see your dentist, you
Go
guys.
see your dentist.
Take your
Go see your
kids there.
dentist. Yes.
Take your kids there. Because I was going to ask what could be some of the dangers of delaying this. Because again, like I said, some of us just say, as long as the child is not complaining, as long as there's no, I don't see anything wrong with the child, why should I be in the dentist, at this time? Why not just wait until the day he or she cries to say, my tooth aches and stuff like that. Why should I keep going? I was going to say, what would be some of the dangers of the delay?
The biggest one is infection. That's the biggest thing with any child is you never want your child to have any kind of infection, no matter where it is.
Whatsoever.
Any kind of infection, and it can get serious just like that. And so again, infection is the biggest is the biggest thing. The moment your child start complaining of pain, it's already
It's gone past
it's
the,
gone
the basic
you shouldn't
level.
yes you shouldn't wait until they can't eat, they can't sleep, you cannot sleep. Yeah. It's infection. And they're missing school because they have to go see the dentist, or they didn't sleep at night and they have to stay home, you have to go buy little over the counter stuff to and that's one part. The other part is even finding someone that can even see that child. Of course,
at the time of need.
At that time, of course, you can always take them to the ER if it is that severe, and they might give them some antibiotics and stuff, but you still have to come back to the dentist
for the regular dental check,
and they'll send you back. Go find a dentist. They can't really do much.
Yeah, that's true. They would have to send you to the professionals in that field. Awesome. So some of us listening to you today would say, oh, I see myself in this. I'm going to try and repent from deciding not to do anything until things get worse. What are some of the, I would say, personal hygiene you would kind of recommend, or probably throw out there to say these are routine things you can do at home, to keep your oral health, going for you and your children as well, especially for our kids?
Yes, brushing. It's the number one thing. It's brushing.
And how often do you recommend brushing?
2 times
Twice
a day. Most kids are very excited about brushing them by themselves. They like to brush. Most kids that I know love brushing their teeth. Now, if you happen to have one of those kids that don't like brushing
their teeth,
I'm sorry, you cannot let them run around without brushing their teeth. Let them do it in the morning by themselves. If you're there, you can stand and
supervise what they're doing.
If they're so adamant about doing it themselves. Okay, stand there and say, okay, send your toothbrush this way. Why don't we brush the front or brush the bottom? Like supervise, but let them do it. That way they are learning. However, at night, make sure that you're brushing. What I used to do with my kids when they were really, really young is I would get them, put them on the bed and put their legs in between mine, and then hold their hands and it takes like just a few seconds, and you take the toothbrush in there and brush all of them. I mean, they cry, they open, but then you're getting all the way back there.
All the face. Yeah.
They'll thank you later when they're older, but make sure that you're helping them brush. Flossing is important. Most of the times their front teeth are not so close together, so you can floss. At least get them to the habit of flossing, and then mouth rinse. If you're into that, it's not bad. But I just want to say that mouth rinse does not replace
brushing the teeth. That's a good.
It does not. It does not. I know as adults we people get by with that.
A lot of people do that.
It does not.
A lot of people do that.
So brushing is the biggest. Brushing, cutting down on the sugar. At home.
Okay.
On the juice, on the candy. Okay. I know it makes your kids happy.
I was going to say
it does not help them in any way.
The kids will not like that
and
one.
I'm not judging. I'm a parent too.
They don't want to hear that. So.
But if they don't see it though, if they don't see it, they
wouldn't have it. Yeah, the craving for it.
If it is on there, if it is at home, it's very difficult. Because, okay, you say no, but at some point you're going to say, okay, go get it. go get it and get
Yeah,
get away from it.
yeah,
Get on my
I need
yeah.
my
Especially if
sanity.
you're working or you're
Yeah.
busy with something, like go and get it. And we do that all the time.
So
But
those very, I mean, as you may, what's the word for it now? They would say these are low sugar for kids. There are some drinks they make and they call it low sugar
better
things.
sweet.
There you go. So I always
Should we
keep
say more?
wondering. I always keep
I
wondering. So
mean,
how does this thing get sweet if you guys are saying
I mean,
this
they
is
put like
sweeteners and
they put
all?
they put
Yeah.
sweeteners. They put xylitol on it, which is what is in the sugar-free gum, and
There you
it's
go.
supposed to be like a better form of
Option
sugar
for
and
sugar.
yeah and stuff like that. But
Mm.
does your bacteria or does the bacteria mouth recognize it
Recognize. Oh,
as
that's a good
okay,
one.
this is good sugar, this is bad sugar? I
That's
don't
a good one.
know. I don't know. I say just limit it. You're the parent, and most of the times when parents bring their kids over and they're like, oh, can you talk to them about candy? They like to eat a lot of candy, and in my head I'm going, but
Where did
who
they
buys
find
the
it?
candy though?
Exactly.
Who buys the
Where did they
candy?
find
You
it?
buy the candy
Oh
all the
yeah.
time and the chocolate and everything, and you put it
And
at
you're
home,
complaining.
and then you're like, can you tell them to stop eating? Of course I will,
It starts with you.
it starts with you as the
Yes.
parent. There've got to be some kind of control to yeah.
That's a good one. And then the one thing I was going to ask, but I think you're going to end up sending us back to the dentist. I was going to say, if you were to do like your routine check, like you say, probably when you're brushing your kids or maybe when you're dressing them up, you just say, hey, let me see what's going on in your mouth. And you notice, those, will I say yellow colorations at the base of the teeth. Will that be a right time to say, we need to get to the dentist, or
To get a
let's
cleaning.
just do maybe teeth brushing if that would work? What would be
I
the better?
mean, yes, that could be an indication that it's time for another cleaning, especially if you're due. Or it could also be maybe your child is not brushing very well, because just like you sweat, you take a shower, but then a couple hours later you're sweating
You're
again. You
sweating
can't really,
again.
your body makes sweat. It's just a natural
Nature.
thing that happens. Same thing with plaque. You're brushing your teeth because you don't want plaque to stay on your teeth, because if that plaque and bacteria stays on there, then over time it can cause gingivitis and gum disease and so on and so on. So what's one of the most important reasons why we brush our teeth, is that plaque should not stay
Plaque,
on
yeah.
there. Now your body makes plaque every day. You brush your teeth in the morning, plaque starts forming right away.
And just for our viewers, do you want to explain this plaque? It's that yellowish thing we see on the teeth, right?
It actually starts as white though. It starts as white, and then over time it changes to like kind of like an ivory yellowish,
Yeah.
and then over time it gets more yellowish, and over time it keeps staying there brownish, dark,
Oh, I
greenish,
see.
like really. Then it gets really black, like your T-shirt.
Oh,
And at that point, it's stuck to your teeth like cement. No matter what you do at home, it can't come out. So you have to come to the
Come in
dentist, and we
for
use what we
cleaning.
call a Cavitron to knock that stuff off your teeth.
I see.
Yeah. So
Oh.
yeah.
That's a great one. So I mean, we've learned a lot today. I really appreciate the fact that you took the time to kind of break down how this whole process happens in the mouth, especially with feeding the bacteria with sweets and all of
Yeah.
that. And also, I know you did mention that it's good to start early. As long as the child is born and attains the first year, that would be a good time to pull our kids in for routine check. And the routine check you're advising, that should be at
Yeah.
least 6 months each
Yes.
interval, I'd say, for every year for our children. Okay, that's a good one. And again, I know our kids wouldn't like the fact that we'll say stay away from sweets, but
You can, yeah, you can give your, I mean,
okay.
give
And
instead of apple juice, why don't you substitute it with like fresh apples? Sometimes what I do for my kids is I would do apple slices or grapes, and just leave them in the fridge and let them run around. Especially now that they are home from school, let them run around and
they could
grab a couple,
those.
get a couple of cuties and eat instead of the juice. My husband and I try so much to control the juice intake.
In the house, yeah.
Make sure you ask before before
You
before
take
you
them.
take, or just do fresh fruits and vegetables. Of course, that's the best option. But if you can, I would limit it. If they're going to have juice, let them have it at meals time only. So when they're eating their lunch or something, then they can have the juice. And then after that, okay, no more juice. You get to
So
drink water.
why is it safer to take it at mealtime?
Because we don't want you to consistently be feeding off that bacteria, and we're hoping that once you eat and you take your juice, that's it, and you drink your water, you rinse your mouth, and you're getting rid of that sugar in your mouth at that time, and then you can go around and run around and
Oh, I see. Okay. So even if I were to, let me just ask a very interesting question. Even if I were to say I love my pop, I'm gonna keep drinking them. If I drink them and take maybe quite a huge amount of water, does that rinse the sugar off my mouth, or it doesn't at that point?
if you do, say for example, if you were to like put what Fanta in your mouth, and then you sip it, and then you get water and rinse it off right away. Well, you're getting rid of most of it,
Most of it.
of that sugar in your mouth. You switch very well and spit it out. You're getting rid of some of it because it's not sitting there. The problem is you don't want that sugar to sit
Just sit on.
in your mouth
Yeah.
for a long time for bacteria to break it down.
I see.
And,
That's
yeah.
food. Okay. Interesting. All right.
So
So
switch with it, rinse it out. It's one way. If you can avoid it, even better.
Even better.
Because yeah.
Yeah. Okay. So I think that's a take home for us as parents, is to try to limit the number of sweet things hanging around in the house, because somehow these kids will see them and want to take them, and at some point
And
you
it's
would
difficult to
break.
say
Yeah.
no.
At some point you just break and be like, okay,
It's
go
difficult, it's difficult
go
to
have
say
it.
no.
Yeah, because I need my peace and all of that. Okay, great. So that's a good one. I mean, if you were to give an advice, I would say to especially parents who, like the parents I cited before, who say, until this kid cries that, my teeth is hurting or something is wrong with my mouth, or, parents who wait till that time before they go to see a dentist. If you were to have an advice for parents like that, what would you say to them?
I would say that your oral health is very, very important, and your mouth is not separate from the rest of your body as we think it is. Your mouth is connected to every other part in your body, and they are related. Don't wait until that child is in pain before you start, running around looking for someone to help your child. And the way the system works is it's not an ER where you can just walk in and they'll give you
And get
antibiotics
things
and
done
stuff.
immediately.
Yes, you can call in and they will be able to address emergencies, and say if your child were to fall or something like that, and we might be able to give you a prescription to kind of calm things down. But sometimes it takes multiple appointments to get that child to being healthy again. That's a lot of time off of school.
And
That's
work
a
as
lot
well.
of time off of work for you. And sometimes some people are not able to take that much time off of work. And I cannot tell you how many parents come to the dentist thinking that they'll be able to fix, or address all their child's
In
concerns
an hour visit.
in the same day.
Yes.
It's like, come on, that child, and they're little. We have to be super, super, super patient with them. Because you want them to come back next time. You want them to be excited about coming to the dentist.
To
You
give
don't-
them a great
the last thing we
experience.
want is to make them have a bad experience. Then it becomes really tough for you as a parent and tough for us as clinicians to work with that child, and then they don't want to come back.
That's
So
right.
being in pain, it's not fun. It's not fun.
It's
Yeah.
not. I agree.
Besides, why do you wanna go take a cycle when you can just take a straight path and come here? So just bring your child every 6 months, rather than wait until things are really
Things
bad
get
before
worse
you
and out of
start
hand. Yeah.
trying to find someone. And it's even worse if you stay away from the cities and you can't find a dental office close to you, and then you have to drive far away,
Yeah,
to
to be
find
able to
someone.
get.
And most pediatric offices also have an age limit too, because if your child is at a certain age, sometimes there are long waiting lists, really long waiting list. You have to call and call. It's really tough for some
It's
parents out
tough.
there. Yeah, it is, especially if you have like an 8 year, 7 year old with a lot of stuff going on, and some kids just can't handle being in that chair, and they need more stuff. They need maybe
Quick
laughing
attention.
gas and
Yeah.
stuff like that to make them a little more comfortable. Then you have to find an office that will be able to do that for your child. So it becomes a
The issue
hassle
just grows and
for you.
grows
So
and
yeah,
grows. So
I
that's
would get it done. I mean, we're talking about extremes here, but they say prevention is better
yeah,
than
that's yeah,
cure. So
exactly. That's right.
bring your
So
child in early so we can catch things
as quickly as
as quickly
possible
as
before it
possible.
escalates. Great. Thank you so much. We've learned a lot today. We have learned a lot today, and I'm hoping our viewers and parents at home, guardians, as she has said today, let's do that due diligence to see how we can take our kids in for
Yes, very important.
routine dental check. Right? Don't wait until things get out of
Every
hand.
6 months.
Every 6 months, I know. I hope that's doable. Every 6 months, you guys. So that's what the recommendation is, a dental recommendation to make sure that we can get there, every 6 months to make sure that we can stop these things early enough before it gets worse. I know there's this new electric toothbrush going on now. Is that a good use for kids, or you just feel like, well, maybe not really? It
Of course, there's a
is.
lot of
Yay. Tell us
there's
more.
actually a lot of scientific evidence out there that shows that using an electric toothbrush they're just better at removing plaque from your teeth compared to you using your hands or the manual toothbrush to brush your teeth. Now, if your kids are open to an electric toothbrush, you could start with the one that uses battery from Walmart. So you can just use the ones that
The regular one.
the regular ones that you replace the battery every whenever they die. You can start with that, or you can just buy an electric one. So the ones where you have to charge it, just like your phone, to kind of help keep your teeth clean. They can be pretty expensive. However, some of them are pretty decent too. So they could range anywhere from like $19 to up to like $300 and something dollars
Oh, I see. That's quite pricey for an
electric
electric
toothbrush.
brush.
But they're pretty awesome. They're pretty good.
So it's a good option as well.
Yep.
Okay, so do you have any with you you'd like to show to our viewers today?
Definitely.
Oh, you do? Great. So
So
let's take a quick look and see how this toothbrush actually does work.
this is the Wanky electric toothbrush that we have here. And I'm just gonna unbox it for you guys.
Oh, and it's very well packaged. I love that.
Yes, this is the traveling case that comes with it, and of course it's got the Wanky logo on it as well.
Okay.
I'll put that right
That's
there.
awesome. So this you can put in your box if you need to.
So if you're traveling, you
get
don't
out of
have to go
town.
with all of this.
I
If you're
see.
going on a little vacation or a little get together, you don't have to travel with all of this and occupy more space in your hand luggage. All you have to do is put the toothbrush in the travel case, and this is what it looks like.
I love the packaging. It's
I know.
beautiful.
So this is the pink. We also have it in black as well,
Oh wow, this is
and
awesome.
we have it in white as well. So
Oh guys, this is beautiful. I love the packaging. This is so nice.
it looks awesome. And I'm just gonna go ahead and show you what it looks like inside.
Yes.
So if you open it, this is just the user's manual in here, and it looks like so.
Oh, I see.
So you take the toothbrush out and take this part out. So it comes with two heads. It also comes with like a charging base and a cord as well. So you will take it out just like so. The cool thing about this product is, first of all, it has this protective casing on there. So if you stand it by your sink, that way dust doesn't get onto your bristles while your toothbrush is drying out. So you will connect the head just like so. Now, this toothbrush has 4 settings on there. It's got the clean, so if you push it on there, this is the first setting. And then this setting is just, it's nice for your everyday use.
Okay.
For people with braces, can use this if you have braces on. Implants as well, you can use this. So just your regular standard brushing. Now, the recommended brushing time is 2 minutes.
I see.
You want to brush for 2 minutes. This toothbrush is already pre-timed, set for you for 2 minutes. So if I were to leave this vibrating on there, it's going to go off on its own
For after 2 minutes.
Now, the cool thing about this too is that every 30 seconds, I don't know if you catch that, but every 30 seconds it pauses to let you know to switch to a different quadrant of your mouth.
Oh, I
So if you
see.
started brushing on here, after 30 seconds, switch to this part. 30 seconds is going to pause again and switch here. 30 seconds, switch it. So
Go to
30,
the
30,
top.
30, that brings it down to 2 minutes and it goes off.
That's awesome.
So which is really nice, and you can also change it, so by pushing it the second time it will go into whitening. Now if you notice, this toothbrush is pre-equipped with that LED blue coal light, which is what we use in clinic for whitening teeth. Now this on its own will not automatically make your teeth white. You'll have to use some kind of whitening agent with it. I recommend, if you're someone who whitens your teeth, of course you want to use this alongside a whitening toothpaste together with it. That's just going to help keep things nice and at least remove a little bit of staining for you. The next option down here is polishing. Personally, I like to use this every now and then to just kind of polish your teeth, especially if you've had like a cup of coffee, or if you're a smoker, you want to use this as well. Or if you drink red wine, you want to use this. Or if you drink, some people out there like juicing, a lot of green juice, you want to use this every now and then to kind of polish your teeth as well. The very last one is gum care. That's what it says on there. This is for people with very, very sensitive teeth. If your teeth are really sensitive, you want to use that on there. And if you have a lot of recession, so if you have a gums that have receded, you want to use this on there, because if you notice, it's pausing a little bit. So every time you change it, it vibrates differently, which is pretty cool. So it's not just a uniform vibration. So if you change it, whatever setting you use, it changes as well. So pretty cool.
Wow, this is awesome.
In addition to that, one of the questions that I get all the time is, when do I know when to change my the head and to put a new one in? So this toothbrush is equipped with a blue bristles in the middle. Once the blue bristles, the color fades away, that's when you know to take this out, and you twist it out and then throw it, get the next head and put it back.
And put it on.
Perfect.
Oh.
And it's soft too, because we always recommend that people use a very soft bristle brush.
I see. Great.
So definitely you can get this today at our website. wwanky.shop. Google it and then get your product, and we'll ship it out to you wherever you are
in the world. Awesome. Great. And yes, like I said, we'll be putting that website for you on the screen, so that way you can also get yours. If you're the type who would rather use an electric toothbrush, this is a very good option for you to try. Again,
Definitely.
thank you Ule, for this great one, and hopefully we'll be able to get it out there to all our viewers, and everybody can also have access to it. Awesome. That's really that's a good one, and I think we've learned a lot today. Thank you so much. We really appreciate your time with us. So viewers, I hope we've been able to learn a thing or two that we can use to help ourselves, help our kids, keep their dental health in check. Just to make sure they're growing normal and growing well without having issues, especially with their oral health. Awesome. All right, Ule, thank you so much for being here today. We really appreciate your time with us.
Thank you for having me. It was such an honor. And if you're a parent out there, you're looking to get an electric toothbrush, whether it's for yourself or your spouse or your young ones, you can always just reach out to our website. It's wwanky.shop. And you can find electric toothbrushes there.
Awesome. And I'll be putting that on the screen as well, so that way you can see directly and reach out to her for those tips as well. Thank you, Lee, for being on the show. Thank you. And to our viewers at home, thank you guys. Again, I'm your host. My name is Ify. Until I come your way again, enjoy the rest days ahead. Thanks.